Welcome back. Now we talk about next lecture, lecture number 6, about the recent update in Harrison 19th edition. So in this we talk about something. Let's see what all new things have come in the respiratory system. We talk about some change has occurred in ARDS. ARDS is the one topic about which most of the students are not very comfortable. So first we learn the basic concepts about the ARDS, then I'll tell you what changes has occurred in the 19th edition. So first we learn the basic concept about ARDS, Adult Respiratory Distress Syndrome. Let's learn the basic pathology. First we learn the basic pathology. Here is the alveolus. Here is the pulmonary arteriolar. And oxygen goes like this. CO2 come out like this. This is normal. This is normal. Now in ARDS, a protein-rich fluid accumulates in the interstitium. A protein-rich fluid accumulates in the interstitium. Hence, as you know, oxygen is a water insoluble gas. So oxygen cannot go in. But CO2 is a water soluble gas, it can come out. So that's why in ARDS, there is hypoxia, there is PaO2 is reduced and CO2 reduced, oxygen cannot go in, reduce PaO2, CO2 can come out, reduce CO2. That's why you get type 1 failure in ARDS. Type 1 failure in ARDS, as you know, in type 1 failure means hypoxia with hypocarbia. Now one more thing not known to most of students. Look, here is the pulmonary alveolar oxygen and this is the pulmonary arteriolar oxygen. This gradient, now look, oxygen cannot go in the arteriole. That means this gradient will be increased in type 1. So friends, in type 1 failure, which occurs in ARDS, hypoxia, hypocarbia and increase pulmonary alveolar oxygen and pulmonary arteriolar oxygen gradient is increased. This is the box number 1. Box number 1. Okay. Now before I go, let's learn more basic concept. Let's learn more basic concept. Basic concepts. More basic concept. Normal PaO2 is more than 94, but for easy calculation I am taking 90. And normal FiO2. Now what is FiO2? Let's learn the basic concept. We are breathing oxygen from the atmosphere, you and me, and we know we are taking 21% oxygen from atmosphere. But for easy calculation I take 20%. So we are taking 20% oxygen from the atmosphere. In the scale of 100 we are taking 20. In the scale of 1 it is how much? 0.2. And this is known as FiO2. The normal FiO2 is 0.2. This stands for fractional inspiration of oxygen. Fractional inspiration of oxygen is FiO2. The normal PaO2 is 90 and the FiO2 ratio is how much? 450. 450. The normal PaO2 FiO2 ratio is 450. 450. Next point. You know very well that hypoxia is when we say hypoxia or respiratory failure. When do you call hypoxia or respiratory failure? When PaO2 is less than 60. Now this patient has come to us. His PaO2 is 60 and his FiO2 is still 0.2. Ratio is 300. If ratio comes to 300, we call as acute lung injury. ALI is acute lung injury. Acute lung injury. Make a box. Make a box of this also. Box number 2. Box number 3. Now, further hypoxia has occurred. PaO2 has gone to 40. FiO2 0.2. Ratio 200. Now we call as ARDS. So this was given in 18th edition. But in 19th edition they have changed. What they say? Now what change they have done it? The change they have done is that if this ratio PaO2 FiO2 ratio is less than 300, we call as mild ARDS. Less than 200, moderate ARDS. Less than 100, we call as severe ARDS. This is the box number 4 and 5. The 5 number box is what is given in 19th edition of Harrison. Got it? So how to treat a case of ARDS? You treat by the patient on ventilator, and we can use, of course, treat the basic cause is always the first thing, but otherwise for ARDS we put the patient on ventilator and we increase FiO2. Increase FiO2. So I hope you understood also what the ARDS is like this. Okay, what the ARDS is like this. So now we move further. We talk about, so now we talk about something about COPD. In COPD we got a new drug. For treatment of COPD we got a new drug called roflumilast. This is the 19th edition what they talk about. This was the box number 6. This is the box number 7. The new drug which have come in the 19th edition of Harrison, roflumilast, is the drug that we are using. And one more thing, you should basic concept, for lung transplantation we use Bode index. Bode index is for lung transplantation. And Reed index we use in case of chronic bronchitis. In chronic bronchitis we use Reed index. Well friends, we know very well that smoking is the most important predisposing condition for COPD, and in COPD there is irreversible airway obstruction. So now not everything is for MCQ. Now We know very well that in COPD all the lungs are destroyed, permanently irreversible airway obstruction, and normally chronic bronchitis they manifest in around 40s age and emphysema around 45 or 50 years of the age. And smoking, tobacco is the main predisposing. So it's quite possible that someone listening to me may be a smoker. So as I told you, not everything is for MCQ. I sincerely request all the person who are watching this video, stop smoking from today. Stop smoking for today, because smoking is the one which is really injurious to health. Tobacco in any format is bad. Friends, lung cancer is the commonest lung cancer in the world, but in our country the commonest lung cancer is mouth, because especially in North India many people they chew tobacco in the pan or BD or this thing. So I sincerely request that you stop tobacco in any format, and it will add years to your life and life to your ears. Okay? So maintain a good health is again a paramount important for the studies. Well, so now we got certain drugs which can help in smoking leaving, that is bupropion. Bupropion is the one drug which help in stop smoking, and varenicline. These two drugs they help in stoppage of smoking. Box number 10. Stoppage of drug. Okay? Well, friends, we got new drug in the treatment of bronchial asthma, omalizumab. We are using for treatment of bronchial asthma, and in severe asthma we use even magnesium sulfate. In status asthmaticus we use magnesium sulfate. Now new drug has come. New drug has bombuterol. Bombuterol is a new thing, has come in 19th edition. This is a long-acting beta-2 agonist. It is a long-acting beta-2 agonist, the new compound which has come in 19th edition. This is the box number 11. Okay? Box number 11 we talk about. Well, regarding treatment of tuberculosis, the new updates are as follows. Treatment of tuberculosis. Streptomycin is now a second line drug. It's not a first line drug, it is second line drug. And the new drugs for TB are azithromycin, ofloxacin, amoxiclavulinic acid, amoxiclavulinic acid, azithromycin are the new drugs, and of course linezolid. Make a box 12. So streptomycin is a second line drug, and these are the new anti-tubercle drugs. And one more information you must share. Rifampicin is a very good anti-staphylococcal agent also. Rifampicin is a very good anti-staphylococcal agent also. And please note, these drugs, which are the new anti-tubercle drug, we were primarily using for anti-staphylococcal agent, and rifampicin is a very good anti-staphylococcal agent also. Got it? So these are the anti-tubercle drug. So that means there is something common between the microbiology of Mycobacterium and Staphylococcus. That's why the two drugs are interacting each other. Okay. Well, now we talk something about new techniques. Something about new technique in the microbiology. We got LED microscope. LED technique. We are using, that means fluorescent light microscope. Fluorescent light microscope. This new technique we are using for identification of bacteria, and we are using number one. Number two, interferon gamma technique we are using to look for the Mycobacterium, and of course we got Bactec technique. By this we can grow the bacteria in 7 to 10 days. This is the Bactec to grow the bacteria in 7 to 10 days. Last but not least, PCR is the way that we all know. The new thing in the microbiology for treatment of diagnosis of tuberculosis. Okay. Well, so new drug in the treatment of lung cancers. Lung cancer में we can use cisplatin, carboplatin, etoposide, especially these we use for small cell lung cancer. Small cell lung cancer we use this drug. But new drugs have come up. The new drugs which have come up are bevacizumab, this we are using for lung cancer because this is an anti-angiogenetic drug. This is an anti-angiogenetic drug. Genesis drug, anti-angiogenesis, anti-angiogenesis drug is we talk about is for lung cancer. Now few more drugs that we'll talk to that we got. So this was the box number 14. This is the box number 15. Then we got one drug, methotrexate. This is highly effective in adenocarcinoma. 16 number point. Highly effective in adenocarcinoma. And regarding etoposide again, this is especially useful for small cell lung cancer. And we talk about one more drug, pertuzumab. This is highly effective in breast cancer. Highly effective. This is HER2 antagonist, very effective. New drug, 17 number block. Similarly, now new thing has come up for CA prostate. CA prostate, we use docetaxel. Docetaxel. Docetaxel we also use in lung cancer. But for CA prostate, now it has become almost number one drug for CA prostate. And one more new drug which is not there in even 19th edition of Harrison. That is, we got brenituximab. Brenituximab. And this drug is not given even in 19th edition of Harrison also. This is anti-CD30 drug. Remember, we got anti-CD20 as rituximab. This is anti-CD30 drug we use for lymphomas. And CLL. This is box number 19. Okay. 19 number box. Now I like to share something, few more new drugs which have come for rheumatology. Some new drug for rheumatology. I discussed in previous lecture also, but a few more things have come up in 19th edition. Now, new drugs which are specially updated in 19th edition of Harrison. Rheumatoid arthritis. Remember, the previous drugs I have given you the list in the previous lecture. Now, the drugs which have only recently come in 19th edition, I am talking about those drugs only. So, drug for rheumatoid arthritis is tofacitinib, tofacitinib. This we are using. This is JAK1 and JAK3 inhibitors. Then for SLE, belimumab has been approved, and even DHEA, it has been approved for SLE. This is for rheumatoid arthritis, the box number 20 and 21. So belimumab and DHEA, that is dehydroepiandrosterone. This is box number 21. Now, new drugs for systemic sclerosis. We got anti for PSS, that is for systemic sclerosis. Anti-fibrotic drugs. Anti-fibrotic drug. We have been using penicillamine. But what is there in 19th edition? The two new drugs are pirfenidone. And nintedanib are the two drugs, anti-fibrotic drug. Okay, this is box number 22. They are the what came in 19th edition of Harrison. For Raynaud's phenomena, for Raynaud's phenomena. The new drugs are for Raynaud's phenomena. We have been using bosentan. It is bosentan. Bosentan is an anti-endothelin drug. Plus, now the new drug is sildenafil. Sildenafil has been approved as a for Raynaud phenomena. Even fluoxetine has been approved for Raynaud's. They are the 19th edition update for Raynaud's phenomena. Now, for ankylosing spondylitis, the new drugs, we have been using infliximab, but the new drug which has been approved are Acute, and second drug is Acute. They are the new drugs for ankylosing spondylitis. And for psoriasis, this drug and these two drugs, they are approved for psoriasis also. That is, ustekinumab and secukinumab are approved for psoriasis also. But in psoriasis, there is one more. There are two more drugs which have been approved in psoriasis. That is brodalumab, and it is a phosphodiesterase 4 inhibitor. It is a phosphodiesterase 4 inhibitor, and sorry, this is one drug, and we have got phosphodiesterase we have got another drug is apremilast. This is the phosphodiesterase 4 inhibitor. Okay. So these are the drugs that we are using for psoriasis. This is the box number 24, box 25. Okay. In fibromyalgia, we use, new drug has come is milnacipran. New drug for fibromyalgia, milnacipran. And for neuropathic pain, we got Nebilon for neuropathic pains. They are the new drug. This is for fibromyalgia, this is for neuropathic pains. 26. Last but not the least, nowadays they are often asking uses of thalidomide. So thalidomide we are using in following condition. Thalidomide we are using for amyloidosis. We are using for Behçet syndrome. We are using for multiple myeloma, for sarcoidosis, and you are using for inflammatory bowel disease also. Box number 27. Uses of thalidomide, amyloidosis, Behçet syndrome, multiple myeloma, inflammatory bowel disease, and sarcoidosis. So friends, so I hope in a series of lecture I could give you a good amount of information for 19th edition update. I hope you also learned regarding prometric system, about which I discussed in the previous section, and I also told you what should be your strategy at this junction, which for that you can see the previous. Now if you want to contact me, you can contact me. You can join me on my Facebook. In Facebook you can like my page. You can you like my page, Dr. Mukesh Bhatia. This is my page, Facebook page. You can join me, and then you can contact me. You can send message by messenger. I'll be too happy to help you out. And last but not least, my book of Medicine Essence is there available. It is based on Harrison. If you have read that book, go through that book. You will get good 20% question will come from that book only. Plus the information what I give you in these lectures. If you know this much, a good amount of recent update which you will not get in any other routine guides, and in that way you will have extra edge over your other colleagues who will not be knowing the question but you know the answers. Wish you all the best. I wish that you should all get success. In case any problem, you can join me on Facebook, Dr. Mukesh Bhatia. Thank you very much. Goodbye.